Yes, I
So,
have it.
That's good. I'm glad to see that.
wait for a couple of days, yeah.
There
So,
is
I want to just talk to you
skeletons
about
playing volleyball. Have you seen that?
why do I do these classes? Why do I, I mean, I could do other things on Tuesday nights, but why do I do these classes? Why would I do this?
Educate the public.
Yeah, I want to make Lincoln a more healthy, vibrant community. I want to educate people on how their bodies are supposed to work.
Yeah.
And so that's why I do these. So tonight, we're going to be talking about what is scientific healthcare. And I want to ask you a question. How would you define, if you could take science down to the very basic level, how would you define science? How do you define it?
Process of life.
Okay,
It's a study of our environment.
okay. Anybody else? Nobody else wants to?
Well, I think of Nikolai Tesla, and he saw everything in circles. The sun, the moon, the planets, down to the atom.
Yeah, he was pretty smart. Pretty
Yeah,
smart
he was.
guy.
And
Yeah.
that inspired some of his things that he came up with.
Yeah.
But I don't know if that applies to your question.
Well, basically, what I would say is
Yeah.
this, is that science is presenting a hypothesis of what you think might be a fact, then doing experiments to try and disprove what you think, and if you can't disprove it, then it's a true scientific fact. That's really what science boils down to. So not everything that's called scientific is actually scientific, and we'll talk about that tonight. So, see if I can get this to work. That's not working, I don't know why.
It's science.
Yeah. Science-based.
It's
yeah.
bad science. Okay, here we go. So, scientific healthcare, evidence-based healthcare actually started in the 90s. If you go back to the 70s and 80s, people just said things and did things and called it scientific in terms of in healthcare. But this was a paradigm shift to make sure that healthcare was actually provable and scientific. And the validity of this model depends on clinical trials, most of which, not all of which, but most of which are conducted by the pharmaceutical industry and reported in the names of senior academics. So, is this a problem?
Yeah.
What's the problem there?
Well, they're the ones that are making the solution.
Critical.
Yeah, so if they do the study and they have a lot of money based on the outcome of that study, there's a lot of money based on it, they're going to do everything they can to make that study come out correct. Okay? Now, not every scientific study is a pharmaceutical study, but a lot of your double-blind, placebo-controlled studies are done by the pharmaceutical industry. And that's a problem because when your research has a lot of money resting on it, you're going to try and make sure it comes out okay. So the integrity of science in an open democratic society requires that scientists take seriously the outcome of experiments. I want to just tell you a little story that I heard recently within the last couple of days. That was probably the last week. So, and this is absolutely nothing against physicians, because I have physicians that are friends that I like a lot and respect a lot. But somebody came up to a physician here in Lincoln, and they said, you know, there is scientific proof now that chiropractic works. Would you like to see it? He said, don't even show it to me. I don't even want to see it. Okay? So there's that kind of bias out there. Okay? So recently released confidential pharmaceutical industry documents into the public domain has provided valuable insight into the degree which the pharmaceutical industry has misrepresented their clinical trials. Now this comes out of the British Medical Journal, the illusion of evidence-based medicine. And so what we want to do is give some evidence-based studies into chiropractic. So we're going to talk about two primary types of clinical studies. There's observational studies. Researchers don't necessarily do experiments or test new treatments, they just observe what's going on. And observational studies help researchers determine what to study on a more specific level. So, can anybody give me an example of an observation that probably wouldn't need a scientific study?
That wouldn't be?
Yeah, that you wouldn't necessarily, an observational study or an observation that would not necessarily need a scientific study, but would be scientific, just based on observation.
Oh, gosh.
I mean, so let's do a real obvious one. If people jump out of an airplane without a parachute, they're gonna die.
Mhm.
Okay, you don't need a double-blind, placebo-controlled research study to show that.
Mhm.
Okay, if people allow themselves to get bit by highly venomous snakes, they're gonna die. You don't need a double-blind
Mhm.
research study to show that. So observational studies do have a lot of valid and validity. However, they don't show everything. So clinical trials is a gold standard of clinical research. They're tightly controlled experiments. Usually you have two groups of people. One group is given a drug or an intervention, or the other group is given a placebo.
Mhm.
In the blinded study, the researcher knows who is receiving the real intervention. I guess I misspelled that word. Double-blinded, neither the patient nor the researcher knows who's getting the drug. So can anybody think of a study that could not be double-blinded?
Well,
Yes.
if the two groups were different. I mean, if you had guys in one group and women on the other group, maybe that wouldn't work.
Okay, so based on sex,
Right, or
Okay.
something like that. Or-
So you couldn't double-blind that.
Yeah. Mhm.
Why not?
Because there are different genetics of people may have different interactions with what you're testing.
So
Yeah.
let's say you're testing
Mhm.
a vitamin supplement,
Mhm.
and you gave it to, you divided the groups up into four groups,
Mhm.
two groups of women, two groups of men.
Mhm.
And you gave a real one to the men,
Mhm.
to one group of the men, a
Mhm.
real one to one group of the women,
Mhm.
and nobody knew who was getting what.
That's right,
And then a fake one,
Okay.
wouldn't that be double blind?
Yeah, if you
trial?
mix the two groups, if you mix the fake and the real ones between the two groups.
Yeah,
Okay.
that's for sure.
Uh-huh.
So here, most of your chiropractic studies can't be double blinded because people know, the doctor knows
Mhm.
who's he's adjusting and who's getting the fake
Mhm.
adjustment.
Mhm.
You can't double blind
Mhm.
that study. So double blind studies really only refer to things that you like, pharmaceuticals and things like that.
Mhm.
So this is the first chiropractic study that was ever done. This is a Windsor autopsies. It was done by a medical doctor, Henry Windsor, back in 1921, and he noticed that people going to chiropractors got really good results. He wanted to find out why. So he did a unique experiment. He did autopsies on both humans and animals to see if there was a relationship between the health of the spine and diseased organs that he found. So he looked at 75 humans and 22 cat cadavers. And he found out of those two groups, 221 diseased organs. And what he found was there's nearly 100% correlation between minor curves of the spine and diseased organs. So if there's a curve in the spine at that juncture, he could actually almost guarantee that organs would be diseased as well. So can I get you to stand up for a second?
Sure.
I just want to, and just
Mhm.
face me, face the TV. So
Mhm.
so what he found basically is that if there's a curvature in this part of the spine,
Mhm.
there's usually heart or lung disease. If it was this part of the spine,
Mhm.
it was stomach, pancreas, gallbladder, liver, or spleen.
Mhm.
And if it was down here, it was kidneys, small intestine, okay, large intestine, and if we're down here,
Mhm.
it was prostate and ovaries. He found that very, you can go ahead and sit down,
Mhm.
thanks.
Okay.
He found that very consistently in
Mhm.
the cadavers that he studied.
Mhm.
So he found out when these spines were subluxated or misaligned, there is a diseased organ that usually followed. So here's what he found. This is what I just showed you.
Mhm.
With the heart and the pericardium, all 20 cases had the upper 5 thoracics involved.
Mm.
The stomach, all 9 stomach diseases had mid-thoracic involvement. Liver disease, all 13 cases had mid-thoracic involvement. Kidney disease were from the lower thoracics, and he found that to be very consistent. Now, some other important findings from this study. It was rare to find an organ disease which was not supplied by the same sympathetic nerves as the vertebra and the curve. So he found consistently that if there was heart disease or lung disease, it was almost always upper thoracic problems.
Mhm.
Many of the organs showed acute disease, while the deformed vertebra were older in nature, and it proved that the curvatures, the problems in the spine, actually preceded the disease. So you got spinal problems first, and then disease came after that. And then disease appeared to precede old age and cause it. What happens is the spine becomes stiff and old as an old age follows. Therefore, we can say a man is as old as his spine. So let's look at, this is an interesting study. This is from the Journal of Manipulative and Physiological Therapeutics, October 2010. The purpose of this study was to compare chiropractic adjustments against disc surgery in patients with sciatica that had lumbar disc herniation. This is a randomized trial, which means they randomly took some of the people, put them in the surgery group, randomly took some people and put them in the chiropractic group. It was the first study to directly compare the efficacy of surgery against spinal manipulation. It's also the first study to report on chiropractic spinal manipulation treatment effects on a group of patients failing other medical management interventions. So they failed everything else, all right? And here's what analgesics, painkillers, lifestyle modification, physiotherapy, massage, and/or acupuncture. None of that worked. So 40 patients were randomized, 20 in each section. All the patients were deemed surgical cases. So patients were assessed at 3 weeks, 6 weeks, 12 weeks, 24 weeks, and 52 weeks after treatment was initiated. At 12 weeks, 60% of the 20 manipulation group demonstrated clear improvement in outcomes and continued to complete the 52-week follow-up period. Those who failed spinal manipulation treatment, their subsequent surgical intervention provided excellent outcomes. So tell me what that means. What does that statement indicate? What does that imply?
There are some cases where chiropractic cannot completely fix the problem, where surgery is necessary, and then there are cases where chiropractic is the answer.
Yeah, that's one thing you can say. What else can you say?
Well, it points the importance of the spine to be aligned.
Yeah, but that's right. So what this says is that the people that underwent chiropractic care had much better surgical outcomes than people that didn't. Okay, so even the people that failed chiropractic, they underwent chiropractic care, the surgery went a whole lot better. That's what that study proved, which is pretty interesting. Here's a University of Iowa study on Medicare patients. This is 2014. Demonstrated that seniors under chiropractic care had fewer functional limitations, less difficulty engaging in activities such as lifting and walking, lower number of doctor's visits and hospitalizations. They concluded that chiropractic had a protective effect, safeguarding them from physical deterioration. There's another study, Chiropractic and Pregnancy. They looked at 115 pregnant women who were experiencing back pain from the pregnancy. None of those women have ever had chiropractic care in the previous 3 months. And so they looked at 1 week into treatment, 52% noticed a reduction in pain. 1 month into treatment, it was 70%, 3 months, 85%. 6 months, it was 90%. 2 other studies on chiropractic and pregnancy revealed that pregnant women under chiropractic care had half the delivery time compared to women with no chiropractic. Why would that be, by the way? Can anybody give me like a reasonable explanation of why this statement would be true? Why would women be able to deliver babies easier if they had chiropractic?
Well, with spinal alignment, the lower part of their body would be just more naturally better for the human person.
Yeah, so that's right.
Uh-huh.
So if the baby comes through this pelvic opening and the pelvis is torqued like this, that's not going to open as easy. Here's another thing. Does the uterus need a nerve supply? Absolutely it does. So if the nerve supply of the uterus is better because they have less lower back issues, they're going to deliver easier.
Oh.
So here's Annals of Internal Medicine. It's 192 patients with back pain, back-related leg pain. Now this is a major medical journal, Annals of Internal Medicine. That's probably certainly the top 10 of all medical journals right there. Half were given chiropractic care with home exercises and advice. Half were given only home exercises with advice. The chiropractic patients were given 20 visits over 12 weeks. At 12 weeks, the chiropractic group had less back pain, less disability, better overall improvement, and patient satisfaction. At 1 year, patients who received chiropractic maintained their overall improvement and satisfaction. So here's a study in Canada. Again, this is from the Journal of Manipulative and Physiological Therapeutics, November-December 2010. It says 2 recent studies, one in Canada, the other in Tennessee, showed that on average, chiropractic care is 40% less costly than medical care, and patients were much more satisfied. And there's the percentages in that study. Here's the Archives of Physical Medicine and Rehabilitation. In this journal, they looked at 40 men who were diagnosed with degenerative disc disease, which is something I see all the time in practice, like pretty much every day. Half were treated with chiropractic adjustments, half with a placebo adjustment. Results from the patients who received one adjustment: they reported less pain, had increased spinal mobility, better hip flexion, and a significant measurable increase in height. So what about chiropractic in the workplace? So this is in the Journal of Occupational and Environmental Medicine. And these 2 studies are interesting. So 70% or 17% of U.S. workers have absenteeism as a result of musculoskeletal conditions, primarily lower back pain, but neck pain as well. So when they had chiropractors on site taking care of their people and taking care of them even when they weren't in pain, what they had is improvement in both pain and functional status. The health costs were lowered. Workers used fewer drugs and had less physician visits, reduced work absenteeism, increased employee productivity. So here's another study. This is cervical disc herniation, so the neck, herniated disc in the neck with pain radiating into the arm. This study included 50 patients with confirmed cervical disc herniation, so they had an MRI which showed it. And they were treated with chiropractic. Patients in this study had neck pain with moderate to severe arm pain. So patients were given chiropractic adjustments at 2 times to 4 weeks until pain-free. So at 2 weeks of care, 55% were improved. At 4 weeks, close to 69%. And at 3 months, about 86%. Spinal manipulative therapy was 2 to 3 times superior to published studies of patients receiving a cervical nerve block with steroids. So what about changes in the biochemistry? So far we've talked primarily about pain. What happens when you adjust somebody? What happens to the biochemistry? Well, this study looked at 3 primary chemicals known to suppress pain, and they have other physiological effects too. And what they found was these chemicals changed for the better. Neurotensin, oxytocin, and cortisol all changed with chiropractic care. Medical Science Monitor in 2016 investigated what happens when an individual loses their cervical curve. So you hold your finger out like this, that's the way a neck is supposed to look, and it balances the head just like that. So when you lose the curve, it's either straight or it's reversed like this. Okay, so they were looking at what happens when an individual loses a cervical curve. Number 1 is it causes disruptive biomechanics triggering a degenerative process. So the vertebra, the discs start to degenerate. Neck pain, upper thoracic pain, shoulder pain, headaches, and poor health-related quality of life. Loss of cervical curve also causes a decrease in blood flow to the brain due to changes in the vertebral artery. So when you look at the curve in your neck, you have an artery, 2 arteries that go on each side of the neck called the vertebral artery. They help bring blood to the brain. So when you take that, you straighten it or you reverse it, you stretch those arteries, you make the diameter smaller, and what happens, the brain doesn't get as much blood. So here's a normal curve, here's a reverse curve. So this would be something that would typically happen in an automobile accident. So what about chiropractic and migraines? So this article was published in Complementary Therapies in Medicine, 2015. So they had 3 groups of migraine sufferers were divided into the 3 groups. One received chiropractic adjustment and drugs. One group received a sham adjustment and drugs. One group received drugs only. So the study lasted 6 months. After 6 months, the results of the study are as follows. The manipulation plus drug group were able to reduce their drugs by 80%. Their migraines were reduced by 97%. And their functional disability was reduced by 100%. The meds plus sham manipulation, so fake adjustment, they reduced their drugs by 68%. Their migraines were reduced by 17%. And they had a 33% reduction in functional disability. The meds only group, they didn't do so well. There's no reduction in medication after 6 months. They had a 1% reduction in migraine headaches and a 0% reduction in functional disability. So I have a question for you guys. Why did the fake manipulation group do so well? Got the group that got the sham manipulation, why would they do as well as they did? Anybody?
They believed it.
Could be.
Psychologically, they thought they were getting help.
Which tells you
It's
a
mental.
lot about how
Mental.
what we believe affects us.
Yes.
But I think there's another thing going on here as well. That's a great point, a really good point. What else might be going on here? How about the healing power of being touched by a caring human being?
Mhm.
You think that might be an issue? Like, in other words, they got a fake adjustment, but they were being touched
Mhm.
on a regular basis.
Mhm.
Okay, so that could be another part of why they did as well as they did.
Mhm.
Heidi Habit is a chiropractor. She's also a PhD in neuroscience, and she's published 50 papers on how chiropractic care affects the central nervous system. So central nervous system is brain, spinal cord. what she found, spinal subluxations cause abnormal feedback to the brain, which causes abnormal brain function and thus abnormal feedback to the body. This causes poor control of the spine and body, leading to pain and loss of function, change in balance control, reaction times, depth perception, increase in muscle fatigue, and loss of muscle strength in the legs. And she's very, very detailed about how the instrument she uses to measure this and how she measures it. She's very, very specific about it. And she's been published a lot in neuroscience journals. According to Dr. Havoc, and I've heard her speak twice, by the way. She's come to the Nebraska Chiropractic Physicians Association, flew her in from New Zealand, which is where she lives, and had her speak to us a year ago. According to Dr. Havoc, the most interesting thing that has come from her research is that chiropractic care, adjusting the spine to restore spinal function, actually changes the way the brain functions. Pretty interesting. So when you get adjusted, I'm not just affecting that segmental level, we're affecting the way that your brain processes information. So Dr. Havoc found that a single chiropractic adjustment positively alters all sorts of processing in the brain and central nervous system, including how the brain controls muscles, how the brain increases the strength of muscles, how the brain reduces muscle fatigue, and it affects immune and endocrine function, which is why I recommend that when you get sick, get adjusted, okay? That's gonna help your immune system a lot, all right? Now, the last thing we're gonna talk about is this concept that, and you guys, I really want you to understand this, is called NNT and NNH. Everybody that does pharmaceutical research understands what this is. Now, the NNT is the number of people that need to be treated with a particular therapy to get one individual well or to prevent one occurrence. So how many drugs do you have to give a person before one person gets better? That's basically what we're talking about. It's called NNT. NNH is the number needed to harm. So how many pharmaceuticals or how many interventions do you need to give people before one person is harmed? All right, so let's talk about NNT, number needed to treat, NNH, number needed to harm, okay? So let's look at some common pharmaceuticals and procedures. Statin drugs you need to give about 1 in 103 people over 5 years. So if you have 103 people that take statins over 5 years, 1 benefits. The other 102 people get no benefit at all. Does that seem like a good deal?
No.
No. Okay. And in fact, the book that I just read, The Lies written by a physician called The Lies I Taught in Medical School, confirmed that figure in his book. Let's look at antibiotics for upper respiratory infection. None were helped for infection. 1 in 6 were helped for cough. So the other 5 got no benefit. Coronary bypass for preventing death in 10 years. So look how many people survive in 10 years. 1 in 25 are helped. So the other 24 don't get any benefit. And aspirin to prevent heart attack. 1 in 2,000 helped. So the other 1,999 took the aspirin, didn't do any good at all. Does that sound like a good thing?
No.
No, it doesn't to me either. So according to statistical calculations based on available evidence for the Pfizer and Moderna vaccines, now we're talking about COVID, the NNT for these vaccines is as follows. Pfizer, 147. So if you're getting the Pfizer vaccine, 147 people need to be vaccinated before 1 is helped. With Moderna, it was 91. Does that sound like a good deal? Doesn't to me, okay? So I'm not going to tell you to get vaccinated or not get vaccinated, but you need to be educated on the figures so you can at least make an informed decision. So the NNT of chiropractic care is estimated to be 1.8 to 2.4. So out of every 3 people who get adjusted, 1.8 to 2.4 are benefited. Now, that's all I'm going to talk about tonight. But there's something that I do want to say is that in the next couple of days, we're having what's called a Patient Appreciation Day. We're going to be doing we're going to have some food available. So if you come in for an adjustment on Wednesday and Thursday, there's going to be some food out. It's reasonably healthy, okay? I don't have any pudding cups or anything like that. Okay, so we're also going to be offering, we still have 5 slots left, free spinal checkups for anybody that you know that might need, just get checked, okay?
So that'll
So,
be a new person.
brand new person,
New
right,
person.
new person, right. Somebody that hasn't
When
been
will
around.
those free spinal checkups be? What days or how soon?
It's tomorrow and Thursday,
Oh, gosh.
Yeah.
Okay.
yeah. And we have a board in the back that shows
Okay,
the
fine.
times that we have.
Okay, yeah.
So we'll do a 15-minute checkup.
Mhm.
It'll be done at our expense. We just want to be able to see if we can help
Mhm.
people with problems that they have,
Mhm.
so they don't have to suffer.
Yeah.
So think about that, and if you know of somebody, have them call our office. We'd be glad to do that for them.
Mhm.
So, are there any questions about anything that I've gone over? Yes.
Do you know on these vaccinations with flu and you know,
The flu shot and
flu shot 19, yeah,
COVID and BSR.
they give you a choice of either Pfizer or Moderna.
Yeah.
You know what they said at the pharmacy?
Pfizer.
They go,
It's
I asked for Pfizer. They go, well, Moderna's a prettier bottle. And I go, wow, I'm
That's
gonna
so
choose that because it's pretty, you know.
So there's the figures on
Moderna
that.
is, I think, a good
Uh-huh.
company.
Maybe,
you know.
but their vaccines aren't that good.
Well,
I mean, there's the
I went with
there's the-
Pfizer.
There's the
I think,
NNT on them, so
yeah. I know,
number needed to treat. So
Pfizer is a local company, but, you
Pfizer's
know, they
actually
give
all
you a
over.
choice.
Yeah.
And I
Okay.
didn't think they
Worldwide.
would, but Medicaid pays for it.
Okay. Anybody else?
Well, if there's a difference between those two, why are they giving us a choice? Why don't you choose the best one?
Well, why don't they tell you?
Okay, that's right.
You know, that's what I'm saying.
Why don't they give you
And,
those results?
here's the thing.
Yeah.
I wouldn't take either one of them. I just
Okay.
wouldn't do it.
Right,
Okay.
I don't either.
There's too many problems with these. I had 2 relatives that died from the vaccines.
Wow.
No way I would do it. But
Yeah.
I just wanted to show you
Mhm.
what the science shows
Okay.
in terms of number needed to treat. So, good,
Yeah.
that's all I have. Thank you so much for coming out and spending a half an hour learning some things. I hope you got something out of this. And in 2 weeks, what's our class in 2 weeks?
Resolving conflicts in nutrition.
Yes, we're gonna talk about nutrition in 2 weeks. So
Okay,
if
okay.
you're gonna find out a lot more about nutrition, come to class in 2 weeks.
Okay.
Sure.
So good, thank you very much.